The important points to consider when you're selecting the first anti-seizure medicine is, first of all, it's important to try and find that forever drug for people right out of the box, because if they have to change it later, if it doesn't work, there's a chance of destabilization after people finally get some confidence, perhaps. So it's much, much better to try and get it right the first time. There are 3 things you really need to consider. The very first and most important is, what is the epilepsy type, syndrome, and seizure type that the individual is experiencing? Because obviously, if you don't pick a drug that is good for that seizure type or syndrome, it's not going to work. So the first thing is to limit your choices, make a good diagnosis, limit your choices to the ones that are appropriate for that person. The second thing is to understand the important things about that particular individual that makes them unique. It's not a one-size-fits-all. So does that person want to have children? Do you have to worry about the impact on your childbearing? Is that person on any other medications? Do they have mood issues? Are they concerned about weight? Are they very concerned about being very sharp for work? Do they have a work that they can't miss a beat? All of these things you need to understand about the individual. And then the third thing is to understand the same things about the medications that are now in your list that you're choosing from. So is that drug safe in women of childbearing age? Does it cause weight gain, weight loss? Does it cause mood problems? A good example is that right now, the drug around the world that is often selected as first line is Levetiracetam, or Keppra. Makes sense because it's easy to use, it's easily dosed, you don't have to remember a whole lot of dosing principles. But unfortunately, a substantial number of people who use it do have mood issues associated with it. So if you already know that individual has anxiety or depression, that should not be the first drug that you choose unless there's compelling reasons otherwise to choose it.